Welcome to NCPDP Unscripted, the podcast where healthcare meets real talk. Each episode, we will dive into unscripted conversations with industry leaders, changemakers, and innovators discussing the challenges, breakthroughs, and behind-the-scenes stories you won't hear anywhere else.
Well, we are here at the NCPDP Annual Conference 2026, and I am thrilled to have Amy Gleason, U.S. DOGE Services and advisor to CMS, joining us for the NCPDP Unscripted podcast. So, Amy, welcome.
Thanks for having me.
Yeah, so we just got out of a big HHS session, a lot of your colleagues, leadership colleagues, just to talk about what's going on at the federal level. And, I have heard your story quite a few times and would just love for you to share with our audience. I know you spent some time at CMS in the past. You're now back, and you have a very personal story of what you're doing. So would love for you to share with us that story.
Yes, so I started off my career in the emergency room as a nurse and really saw how dangerous it was when providers didn't have the information they needed to treat patients, and how we rely on patients to remember all of that information at a time when they're not at their best, they're in pain, they're scared, and it's not very realistic to expect them to remember all of that and be able to recount it on demand. So that's really what got me into technology, where I started working on electronic medical records and practice management systems, a little supply chain and lab. But then it all became much more personal, as you said, when I saw it as a parent. So my then 10-year-old daughter started having these strange symptoms when she was about 10 years old. She was a competitive gymnast and cheerleader, really energetic child. We called her the Energizer Bunny because she just never stopped moving. She never really had any health issues. And then she started having these rashes. And then, just seemed not that important. She was hitting her legs and her arms on the mats a lot. We thought maybe that was it, but steroids didn't get rid of them, and she kept going to see the doctor. Then she got strep throat several times and was seeming to have trouble, had her tonsils out. Again, not that unusual. Then she started breaking bones and losing her tumbling. She got to where she was, doing flipping twists to where she couldn't do a handstand longer than me. And then, this was all getting more alarming. We keep going to all these different doctors. And eventually she couldn't stand up off the floor, walk up the stairs. Wow. And ironically, she was diagnosed at a dermatologist by a skin biopsy that they were trying to figure out how to treat her rashes. And that's how they found she had a life-threatening autoimmune disease called juvenile dermatomyositis. And so that really started our journey in a much different way, where I got to see what it's like as a parent and a caregiver and a patient, where she sees 12 doctors across 6 health systems, and she takes 21 pills a day, gets 2 infusions a month, and has had many hospital visits through that journey. And so she has 51 patient portals where her data is siloed across. And I really believe that if any doctor had seen all of her information at one place, instead of it being split in the pediatrician and in the orthopedic and the GI doctor and all of the different specialists, if somebody had just seen it all together, somebody would have at least said, why is a healthy 11-year-old going to the doctor so much? And maybe AI today would have been able to catch it much faster. And so that's really why I'm so passionate at this. I started a company after she was diagnosed to help other patients. And then, as you said, this is my second tour in the government. So I've tried to fix it from every angle possible. And if it's the last thing I do, I will get interoperability to work.
I love it. And, every time I hear that story, as a mom myself, right? I mean, it's just heartbreaking, and it's so difficult, whether you are the patient or you're, like you said, the caregiver or a parent. I mean, there's no reason that it should be like this. So talk a little bit about the CMS Health Tech Ecosystem and what you guys are doing there.
Yes, so the idea of the health tech ecosystem was we've been regulating interoperability and electronic medical records for over 20 years. We've paid $30 billion through meaningful use to hopefully get to interoperability, but really we got as far as electronic, but it still created siloed digital versions of the same thing. And then we've had TEFCA and the QHINs and coming through the 21st Century Cures Act. It's helped to drive a lot of network and interoperability. And of course, we've had CMS interoperability rules and others that have been driving interoperability. But when you put it all together in your average experience, it's just not working the way it should. Right. So the idea of the CMS Health Tech Ecosystem was to take a different approach and to do a voluntary effort and really to ask the industry to come along with us toward a vision that we could accomplish in a year's time. So we've been doing this for 20 years. Why not try to do something in a year that could show real meaningful progress? So we asked everyone, the big tech companies, Apple, Google, Microsoft, Amazon, OpenAI, Anthropic, etc., plus the big EHR companies, Epic, Oracle, Meditech, Athena Health, eClinicalWorks, and so on, plus the payers and providers and patients to actually all come along and work together to this vision. So last July, we launched at the White House with the President, Secretary Kennedy, Dr. Oz, and myself. And the main goal was first to fix interoperability and to show meaningful progress for 3 use cases. Patients, to be able to get their data without having to sign into patient portals or remember all the doctors that they've been to, and to use their identity to do that. So instead of having to do all those portals, you could use your like ID.me or Clear, a modern identity credential to prove you are who you say you are once. And then also to be able to push like one button and get all your data in theory without all the patient portals, but also to be able to see who else is getting your data. So transparency is an important part of this. But that puts some trust in from the patients, because providers also want to make sure they're giving the right data to the right person. The middle part is the provider. So providers have had the most success in provider-to-provider interoperability of all the use cases. It's been the most focused on. But even there, providers are having a hard time getting all the data there, partially due to things like patient matching standards not being as great, partly due to connectivity, but a lot due to trust and delegation. So providers want to delegate their access to a value-based care partner or to an ACO, somebody they're working with. That process is a lot harder than it should be. So we wanted to work on that. And then on the payer side, payers aren't involved really in interoperability at all today. So we wanted to bring them to the table, both to share the data they have, like claims data, but also to let them start to experience some of this by querying for quality data and claims clinical data for claims that they received in the last 60 days. That was like the interoperability side. But the point of doing all that is actually to drive use cases that have real value. And so we chose to focus on the patient first. So we have 3 patient use cases. The first is kill the clipboard. So everybody hates filling out the clipboard, or you have to rewrite all of your information. My daughter has to write 21 meds on that little field every time she goes in, and she hates it. I hear about it a lot. So kill the clipboard is use your identity, push that button, get your data, but then you have a QR code that you can take into the doctor and scan, and then they can take all your information straight from there without any trouble, just like you do at the airport. The next part is once you have all that data, to use conversational AI on top of it. So once you have the power of your data, that AI can be personalized to you, and it's there 24 hours a day. You can get recommendations and advice that are meaningful to you, not just generic medical advice that you would get otherwise. And then off of that, diabetes and obesity, making that personalized straight up the MAHA, Make America Healthy Again lane to help with that. So that's really what it's about. We have over 700 organizations now that are working with us. We started with 60 last July. So the minimum has been pretty great. And what that really means is we've created working groups. So we have a Slack that's with public and private all together in one Slack. We have channels and work groups that are really working through these issues. So it's really getting all the stakeholders together to hash out, okay, how can we make this better, to test it and then put it into production, and so that we can meaningfully change. So it's kind of like a giant hackathon with lots of different pieces and parts.
Yeah, that's great. And I've been on the Slack channel, and it's amazing. I mean, people are so dedicated, and I think that's so important because, you know, and I've heard you say this before, and your colleagues at ONC, that, you know, some of this stuff is happening, and then you're going to be able to see what works and what doesn't, and then bring that into the fold of nationwide data exchange and things like that. So I think that's...
Well, I think one of the most valuable parts, too, is having the patients and caregivers there along with everyone else, because sometimes what we think is easy, patients then go try it and they're like, this doesn't make any sense. And so, for example, right now we're working on a page on our ecosystem that's like a step-by-step. You're a patient, how do I do this? Because while we try for the apps and everything to be intuitive, they actually asked, well, how do I know which app to pick? And so how do I choose that? And we hadn't really gone back far enough in our explanation. So having them there really helps as well. And having all stakeholders, like we really want pharmacists to be participating, as well as the pharmacy chains being there to help with us. They're often the front line in that, along with everyone else in the ecosystem. So we need all the unique voices to be together so we can get the right solutions.
Yeah, absolutely. And when you were talking about that QR code, I can imagine going into the pharmacy, right? And then being
100%.
able to scan that. And you know, a lot of what we're doing here at NCPDP is trying to get the people to recognize the pharmacists. they're not just dispensing medications, they're also doing clinical services. So we've been working a lot with Sequoia Project and trying to figure out how to get pharmacists onto TEFCA. And, we're at NCPDP is a friend of the network. And
Right.
so, we're now starting to socialize to our membership as well how important it is to be part of that. So,
Well, and especially with the Rural Health Transformation Fund, with this $50 billion going to states, pharmacists are often the only person around in some areas. And so we need to make sure they're equipped. And the QR code is a great way to kind of break through that. And the patient can just say, hey, pharmacist, I trust you. Here's my information. And they can give better help, both medically and from a prescription perspective.
Yeah, absolutely. So one last question. I just saw today, actually this morning, that you guys announced a new use case that's focused on prior authorization. Would love to have you talk a little bit about that.
Yes, and so the whole idea of the ecosystem, as I said, is to create this kind of foundational interoperability and also just to quell any myths. We are very good friends with ONC, and this is not to be competitive to TEFCA. It's to try to provide kind of that hackathon piece to move faster and then help them have proof things that work or don't work, and then they can add it into more of a regulatory process. So just to make sure I say that. But also this to stand up new use cases once we get that foundation there. So one of our first new use cases is around prior auth, but it is medical prior auth to start with. So we're just kicking that off, but we do have plans to add in a prescription prior auth as well, probably later this summer.
Fantastic. Yeah, and that's something we're obviously focused on as well. So, Amy, just, I love what you're doing. I think it's been really a breath of fresh air for so many of us that have been in the industry for so long. And just, what are you hopeful for? I'm sure you're seeing a lot of success in this. And, just kind of to close it out, what are you hopeful for out of all this?
Yeah, I mean, I see so much promise with AI coming, and I think it can really be an empowering thing for patients. I've seen it very firsthand with my daughter. She's also trained my 84-year-old father on how to use this, and he's now, acting like a digital native with this. So I think it's really amazing that often you're alone when you don't feel well or you're scared or you aren't exactly sure who to give your deepest thoughts to and get feedback. A lot of times patients don't tell their providers everything.
Right.
And so I really think by having that foundational information, it can give you guidance. Not to replace your doctor, you should always still have that access as well. But it's something that can be available right when you need it and can drive you to things. So I'm really hopeful to see that happen. I always say that it sucks to be a patient, but it shouldn't suck to be in the process of being a patient. So I think, I see a lot of promise in these tools being able to help people.
Oh, that's fantastic. Well, thank you again for flying out to Phoenix to be with us this afternoon and joining me on this podcast. Really appreciate it. And we're going to keep following the work that you're doing.
Thank you so much for being part of it.
That's a wrap on this episode of NCPDP Unscripted. Thanks for joining us as we explore the voices and ideas driving innovation in healthcare. If you'd like to be a guest on the show or have topic ideas you'd love to hear us cover, we want to hear from you. Until next time, stay curious, stay connected, and stay unscripted. Our podcast is proudly sponsored by Marks Productions.